Acute epiglottitis is an acute and life-threatening infection in which the epiglottis and surrounding tissue becomes acutely inflamed and edematous, causing severe obstruction of the upper airways. The disease tends to run an extremely rapid course, 4 to 6 hours, to respiratory failure and death. Wow. And it's more common in children. However, the incidence has reduced significantly due to the current immunization schedule with a pentavalent vaccine. Examination of the throat in patients with this condition must be done only in the presence of a doctor capable and ready to intubate. Causes: Haemophilus influenza type B, Streptococcus pyogenes, Streptococcus pneumoniae, and Staphylococcus aureus. The symptoms are sudden onset of high fever, drooling of saliva, dysphagia, difficulty breathing. The signs that are usually elicited are extremely ill and toxic child, fever, head is held forward to extend the neck, breathing difficulty, weak voice, not hoarse, a reduced air entry on auscultation, and also stridor, cyanosis in very sick children, swollen and reddened epiglottis. Investigations are FBC, blood culture, lateral soft tissue, X-ray of the neck. Main treatment objectives are to relieve obstruction, to treat bacteremia, non-pharmacological treatment, establishment of airway if necessary by intubation or tracheostomy. Pharmacological treatments: for first-line treatment in bacterial infection, you give cefuroxime IV in adults 750 milligrams to 1.5 gram 8 hourly for 7 days. In children, 25 milligrams per kilogram 8 hourly for 7 days. And then you give metronidazole IV in adults 500 milligrams 8 hourly for 7 days. In children, 7.5 milligrams per kilogram 6 hourly for 7 days. Second line treatment, you give cefotaxime IV in adults 1 to 2 grams IV or IM 8 hourly for 7 days. And children, 50 milligrams per kilogram 8 hourly for 7 days. Or amoxicillin clavulanic acid IV in adults 1.2 grams 12 hourly is increased to 1.2 grams 8 hourly for 7 days in severe infections. So children 12 to 18 years, give 600 milligrams to 1.2 grams 12 hourly and increase to 1.2 gram 8 hourly for 7 days in severe infections. 3 months to 12 years, 30 milligrams per kilogram 12 hourly and increase to 30 milligrams per kilogram 8 hourly for 7 days in severe infections. 7 days to 3 months, to give 30 milligrams per kilogram 8 hourly for 7 days. Preterm and less than 7 days, to give 30 milligrams per kilogram 12 hourly for 7 days. The treatment should be changed to oral antibiotics when appropriate and continued for a total of 7 days. The referral criteria: refer all patients immediately to a specialist if there is no expertise available for intubation or tracheostomy.